Hi everyone, I will be talking about Dr. Leana Wen, an emergency physician and public health advocate. To start off, I'll be talking about Dr. Wen's background and experience. She was a Rhodes Scholar during her studies at Oxford, a fellow and consultant with the World Health Organization. She is the Director of Patient-Centered Care Research in the Department of Emergency Medicine at George Washington University. She served as president of the American Medical Student Association and as chair of the International Young Professionals Commission. She also co-wrote the book When Doctors Don't Listen: How to Avoid Misdiagnoses and Unnecessary Tests. This book's motive was to empower patients and to enhance the patient-physician relationship and give patients back control of their health and understanding of what is going on with their health diagnoses. She was the Baltimore Health Commissioner since 2015 and quite recently ended this role actually just last week, October 12th. And she will be replacing Cecile Richards as the new president of Planned Parenthood beginning November 12th, so just in a couple weeks. She will be the first physician in 5 decades to lead the organization. Some of Dr. Wen's special interests within her leadership roles that also highlight her leadership style include patient advocacy and engagement, patient and family-centered care, narrative medicine, social responsibility and medical education, patient-provider communication, international health systems, and healthcare reform and policy. So it's already been made apparent that her insight from the physician viewpoint will be providing a keen perspective. Some of Dr. Wen's accomplishments during her time as Baltimore Health Commissioner include her engagement and involvement with the opioid overdose prevention program. In June of 2017, she signed a standing order, like a blank prescription, which made naloxone, more commonly known as Narcan, the opioid overdose reversal medication, available over the counter for Baltimore City residents. She fought to make Narcan a household name and to establish education settings to teach people how to use the opioid antidote to prevent further overdoses. She also urged for more funding and for Congress to regulate and monitor the price of naloxone, which unfortunately has reached skyrocketing prices and has made it created more hurdles and made it more inaccessible for patients on Medicaid. But with her and other joint efforts, the FDA now requires warning labels on 400 opioids and benzodiazepines, including medications like Valium and Xanax. Additional accomplishments as Health Commissioner include a very recent triumph in August of this year, where she helped the city of Baltimore sue the Trump administration for its active cut on federal funding that went towards the teen pregnancy program in Baltimore. So thankfully they won, and that restored $5 million in grant money for educating teen patient populations. And as part of a farewell statement letter to Baltimore residents, Dr. Wen stated, "A core principle in public health is to go where the need is." And that especially highlights her passion and the significance that she places on public health matters and the role that public health plays in addressing various health issues, especially in regards to women's health and healthcare delivery to vulnerable communities. So it's already been made apparent that her insight from the physician viewpoint will be providing a keen perspective on how healthcare should be delivered to the patient in a health nonprofit setting. So as her mission within her new leadership position coming forth, she states that as a doctor, I will ensure we continue to provide high quality healthcare, including the full range of reproductive care, and will fight with everything I have to protect the access of millions of patients who rely on Planned Parenthood. And this also appeals to her more personal upbringing, being an immigrant from Shanghai, being brought here as a child. She recalls her mother and her sister and herself being cared for by Planned Parenthood and giving them the adequate health care that they needed when other sources of healthcare weren't available. And as when Dr. Wen has continuously strived to create more transparency in medicine and make healthcare services such as drug prescriptions and women's health more accessible, there have been recent criticisms targeting her misleading apolitical agenda in healthcare. So, as a critique for her future role, this stands, and the fact is that a significant portion of Planned Parenthood's funding for their resources comes from the government, which in turn propagates a good portion of those resources in influencing those politics and the candidates that run for those positions. So Planned Parenthood is also bolstered by a network of lobbyists, lawyers, and public relations professionals to ensure regulation is controlled and to protect their source of federal funding. For instance, approximately 1.5 billion taxpayer dollars went to the organization between 2013 and 2015. So moving forward, it would be important for Dr. Wen to acknowledge the nature of the organization's functionality and its codependence in this realm and the political influence that it holds. And it will be important for her to engage with relevant multiple stakeholders in order to successfully function within her role. And that is all I have. Thank you so much.